Hello, ladies and gentlemen, and welcome to another video at the Pharmacist Academy. Woo! So I made this video because I know a lot of you guys think about this when you're getting closer to graduation and you're deciding your pharmacy career path. Now in this video, I'll give you the practical differences between these two. So let's begin right away. Now I'll be focusing on these main things here. So education, qualifications, employment, responsibilities, income, and some pros and cons between these two. So first with the education and qualifications. So usually for the staff pharmacists, you could come fresh out of school and you could become a staff pharmacist. You could find jobs that will hire you for that. But unfortunately, there's a few jobs that still require you to have at least a PGY1 residency before they will hire you as a staff pharmacist. Now for clinical pharmacists, they're usually pharmacy school graduates. They completed a PGY1 residency and or a PGY2 residency. And majority of them also have a board specialty certification. Now in terms of employment for the staff pharmacists, since we were talking about hospital staff pharmacists, obviously they work in a hospital, right? So usually they're in the inpatient pharmacy, verifying orders. You may also see them in ambulatory settings such as clinics, and you're usually part of some kind of labor union depending on which state that we are referring to or institution. And for those of you who don't know, labor union is simply a group of workers who unite to improve their working conditions. These are the people that will bargain with the employers to get raises and stuff like that. Hospital staff pharmacists may work day, evening, or overnight shifts. And they're usually 8-hour shifts, and right after that, they could just leave. Now, for clinical pharmacists, you may see them in more settings because they have more training, so they could be utilized in more places. So aside from the hospital and clinics, of course, in the industry, yes. So even without a fellowship, if you complete a PGY1 and a PGY2 residency, you're more likely to get into the industry. Also, clinical pharmacists usually have an administrative position. So when you get hired as a clinical pharmacist at an institution, you're usually like a manager also. And they usually work day shifts, but keep in mind that they are usually on call also. So they may rotate among like different clinical pharmacists. But in institutions where there's residents, they usually have the residents on call instead. It's more flexible in terms of the shift times, right? So what we will discuss later on is because of their salary-based position, they don't have to clock in exactly at, let's say, 9 o'clock. And that's simply because they don't leave at 5 always when they work. So it really depends, right? So they may come in at 8:45, they may come in at 7 a.m., depending on how much work they feel like they need to complete. And sometimes they may stay later. And when they work extra hours, they do not get overtime. In terms of responsibilities, keep in mind that the staff pharmacist usually just verifies medication orders for the inpatient. They may compound, they may dispense medication, they answer drug information questions, and in certain hospitals, the hospital staff pharmacists may counsel patients. So that really depends, but I've heard of this. And they have minimal to no direct interaction with patients usually. Now for the clinical pharmacists, because of the extra year or two of training, they usually have more roles, right? So some of them could verify orders, right? So clinical pharmacists, let's say, is rounding with the medical team. If the doctor enters an order right there and then, the clinical pharmacist can also verify it. They can compound and also dispense medications. They round with an interdisciplinary team, like I mentioned. So this will include like the physicians, respiratory therapists, social worker, nurses, of course. They counsel patients. This is something that they're known for just because they have more of that direct interaction with the patient. They monitor high alert medications. So let's just say heparin, for example, vancomycin, aminoglycosides. This is something that they will probably monitor on a daily basis to make sure that these patients are not experiencing any toxicities. A little bit different from what the staff pharmacists would do, right? They verify the order and then they move on to the next patient. They may monitor the medication usage, monitor and follow up with patients. So this is also common for the clinical pharmacists because they have that direct patient interaction. So let's say you have a clinical pharmacist in the clinic, they may see that same patient over and over again. So with that, the pharmacist must make sure they're monitoring the patient while they're on their medication. They precept students and residents, and they may present at like certain grand rounds presentations in the hospital. Clinical pharmacists may sometimes also be asked to generate reports. They answer drug information questions. They engage in research, hospital meetings, because like I said, it's usually like an administrative role. They go to conferences such as mid-year, ACCP, HOPA, etc. Pharmacy and nursing education also. So this is very common also for the clinical pharmacists. They're constantly providing in-service or educating the pharmacists and also the nurses. Now for the income, the staff pharmacist is usually paid by the hour. So because of that, they're entitled to overtime if they stay a little bit longer. If they work on holidays, they may get time and a half. But a clinical pharmacist is usually salary based because of that administrative role. And keep in mind that if it is administrative, there's no overtime or time and a half. Now down here, I stated that the salary may vary depending on the state. Now clinical pharmacists may have higher salaries usually, but after overtime and the time and a half, the staff pharmacists may end up making more money annually sometime. So now we're going to discuss some pros and cons of the staff pharmacists and the clinical pharmacists. The staff pharmacists work 8-hour shifts. So once the time hit, they're out. They don't need to stay for an extra minute if they don't want to. They don't have to take the work home, right? They're not going to be home and getting phone calls about issues going on in the pharmacy or to answer a clinical question. Very unlikely for that to happen. You get overtime and time and a half, like I mentioned before. You get scheduled breaks. So this is something that could be a pro or a con. For the clinical pharmacists, they don't usually get scheduled breaks. Whenever you're free, that's when you take your break. If you don't have any time, you probably won't take your break. You can consult with the clinical pharmacist for recommendations and clarification. So they have this safety blanket of having, clinical pharmacists who are a little bit more trained and they have more developed clinical knowledge, for you to consult with whenever you have questions. So that's definitely good to have that kind of resource in the pharmacy. Now, some of the pros of a clinical pharmacist is that you will utilize your full clinical knowledge. So everything that you learn through pharmacy school and through your residency, you will definitely utilize it on a daily basis. You will learn something new consistently from precepting students and residents, and that's one of the things that I love the most. It makes it so easy to gain knowledge all the time because I don't even need to go seek for it. Just the fact that I'm a preceptor, I'm forced to gain this knowledge from these students or residents. The satisfaction of working directly with the healthcare team, this is something that means a lot to some people. They want to have that direct interaction and being able to make recommendations right in front of the medical team. They just appreciate that relationship and that term more. There's more networking opportunities for clinical pharmacists because they are the ones that will more likely go to conferences. There's more opportunities to move up, develop leadership skills, which is huge, more time to review patients and follow up. And that's another thing that I love. You're not on the clock to, verify this order really fast so that you can move on to the next one. You usually have more time to thoroughly review the patient. And in the process of doing that, you also learn about that disease state or something new. So that's why it's really good to be able to have that time. They have that direct patient care. Here are some cons of staff pharmacists and clinical pharmacists. For the staff pharmacist, let's say you have a sick call and we can't get coverage. It's possible to be mandated to cover that shift. The number of medication orders the staff pharmacist is able to safely verify is all that matters, really. And depending on who you are, you may look at this as a pro or con. Less motivation to stay up to date with new clinical information. And that's because, it's not like you have a student that you have to precept. It's not like they have a resident that they have to precept. It's not like they have to go do a presentation. So that may sometimes, reduce the motivation. They have to work weekends, and that's something that clinical pharmacists as administrators do not have to do. For clinical pharmacists, you work longer hours than expected. You're usually the manager by default, And once again, depending on who you are, this could be a pro or a con. Staff pharmacists would depend on you with a lot of things, okay? A lot of the staff pharmacists view you as the one that's, gaining this clinical knowledge because you're on rounds, you're working with the medical doctors, the nurses. They feel like you know a lot, so sometimes they may overwhelm you with a lot of questions. Pay difference versus staff pharmacist is not that huge, right? So even though you went through 2 years of training, sometimes depending on the state and the institution, the pay difference is not that different. You will have a lot on your plate. You saw the responsibilities. That thing went up to 2 slides. You will go home with work. Yes, you will go home with work. Sometimes you may have to reply to emails at home. You may get phone calls. So just keep that in mind. And more loans. The reason why I put this is because of the extra 1 year or 2 year that you used to do a residency, right? You wasn't getting paid full pharmacist salary. You was getting a pay cut. So compared to the staff pharmacists who usually just came out of school and started working, they've been earning pharmacist salary from the jump, right? So they probably started paying off more loans. So that's why I put that there. And that would be the end of this video. I hope this video was able to give you the practical differences between these two. And make sure to like, comment, subscribe, share. Please leave questions if you have any questions. Connect with me on these social media platforms. Thank you for watching this video and take care.